Hello everyone, welcome back to the series of lectures on our course titled Breast Cancer Clinical Pathway 2018. The topic we are looking at today is Introduction to Cancer Chemotherapy. I am Dr. Kelechi Egzo. In today's discussion, our goal is essentially to help you understand the principles of chemotherapy and also understand the side effects of chemotherapy and how to initiate chemotherapy. I understand that many of us who might be taking this course have not had the chance to handle chemotherapy before, so we hope that at the end of this presentation and the handout that comes with it, you will be able to understand how to approach this and feel a little bit more comfortable in having that conversation or even trying out chemotherapy on your patients. And of course, I like to put a caveat here that it's always important to observe these things in person. And we're more than happy to connect you with Nigerian Christian Hospital Aba, where I work and have some experience in dealing with chemotherapy related issues. Okay, let's go on. So, this is just an abridged version of the full handouts, and I'll just give you a rundown of what each section of the handout is. So, the first section is regarding cancer chemotherapy. What actually is chemotherapy? It is essentially the use of drugs to treat cancer. Chemotherapy agents target to they slow down or stop the process of cell division, which is what happens in cancer. I mean, if you understand a little bit of cancer, cancer essentially is the abnormal growth of tissues, and tissues grow through cell division. So one cell gives rise to 10 cells and 1 million cells. Chemotherapy stops all of those things from happening, or at least slows them down. So chemotherapy is done using hormonal agents, immunotherapy agents, or targeted therapy. There are also some called systemic therapy. The agents used in systemic therapy can be given by mouth, that's enteral, or through the veins or muscles, that is the parenteral routes. So just to emphasize again, there are several slides that kind of describe this in the handout. The chemotherapy agents are classified into different groups. So you can have on the top left hand corner, you have the alkylating agents. These ones work on different stages of the cell cycle. So the cell cycle, if I kind of take you back to biology, is how a cell goes from being one cell to being 10 cells. So there is the resting phase, and then so in the main picture here, the one that looks like a wheel, you find the resting phase, and then you would get to the G1 phase, which is where the cell grows and prepares for DNA replication. And in the S phase, that is when the DNA multiplies and the cell starts dividing. And then in the G2 phase, the cell grows a little bit more. And in the M phase, the mitosis phase, it divides into two or more cells. So different agents work at different phases of this. And in treating cancers, we try to bring drugs that work in different phases of cell division so that we can target the cell maximally. That's what this slide illustrates. And there are other slides to explain this in the handout. So the aim of giving systemic chemotherapy is one, to cure, which is to kill the cancer cells completely and they're gone and done. The other is to control. So basically, if we cannot stop the disease from, if we cannot cure the cancer, we try to stop the growth or spread of it. And the other one is palliation. Sometimes you find that cancer cannot be cured, nor can it be controlled. So we just manage the symptoms of cancer to improve quality of life. That is palliation. So in giving chemotherapy, we do not give it like everyday kind of thing like paracetamol, but rather they're given in courses. So courses are like a when you have like two or three drugs together, you give them now, like today, and wait for some days or for some weeks, and then give them again. So each time you give that, it's called a course of chemotherapy, and they are given in courses so that we target the time it takes for cells to divide and for normal cells which are affected by chemotherapy to recover. So in this illustration, we're making this illustration using the drug called the combination called FAC, that is 5-fluorouracil, doxorubicin, and cyclophosphamide. So we give them in 21-day courses, meaning every 21 days or 3 weeks we give the drug. So the blue arrow shows that on the time 0, which is the first day you start, you give the drug, and then the bone marrow cells, bone marrow cells are where we produce, where the body produces red blood cells, white blood cells, and all that stuff. So they go down, and in 21 days they bounce back again, and we give the drug, and they go down and recover, and that way. But below, you see the cancer cells in the black dotted lines. So when you give the drug, the cancer cells go down and they try to recover again, but by the time you give it again, they're not able to recover as much as they did before. And so after several weeks of giving the chemotherapy, if you look at time in weeks in the red arrow below, you find that the cancer cells are diminishing, whereas the blood cells keep bouncing back. But after some time, in some cases, the cancer cells there's a relapse, meaning the cancer cells come back again, and they do not respond to the chemotherapy we were given before. That's not what this slide talks about, and there are several slides after this in the handout that describe this better. So in this section, we're looking at how do you prepare a patient for chemotherapy. The first is to start by history. I mean, everything goes back to basic medicine: history, examination, investigations. Okay, so in the history, you want to find out what's happening here, what are the symptoms like, and before you start chemotherapy or you continue chemotherapy, always ask the patient, how are things today? Are they worse, better, or the same from the last time? So at least you can assess subjectively how the patient is responding to treatment. And then you also need to ask questions regarding the common sites of metastasis for the cancer you're dealing with. So let's say we're looking at breast cancer, which most often metastasizes to the bones, let's say the spine, and then the brain, and the liver, and the chest. So you can ask questions regarding, are you having cough, to rule out chest metastasis, any bone pain, that kind of thing. And of course, you have to examine the patient each time, and that examination would include something like checking the size of the tumor, checking for lymph nodes to know if there's any metastasis, and you have to remember to document your findings clearly. Okay, the next thing I want us to look at is what we call performance status. This is not something that most of us do, but it is very important. So, performance status is a standardized way of describing what your patient's quality of life is at the time you're seeing them. So the ECOG performance status is very common, and I'll encourage you to go over this content in the slides and also check the links that have been provided to understand this better. Because if, for instance, a patient is said to be ECOG 1 or ECOG 0, that means they are active, they can do all they were able to do before the disease started. When a patient gets to ECOG 3, they are only able to do basic things of life like brushing their teeth, and they stay in bed more. So take a look at this, and this is a very important slide, and this part is very important as well. So the next area I want us to focus on is chemotherapy adverse reactions. I'd like you to know that these drugs are not without side effects, and the side effects can be very severe. So you need to take your time to go through the contents in the handouts regarding side effects and what to do. Some of the side effects might be hypersensitivity reaction, which tend to occur early, and if you're giving a drug like paclitaxel or cisplatin or doxorubicin, you can watch out for those. And then drugs like doxorubicin cause a lot of swelling and inflammation of the cannula site. So you kind of have to know a little bit about this. So there's a lot of resources that we have provided to guide you. And we have to stress again the importance of side effects because they can make a patient to stop treatment, and it's just good that you know about them. We are almost at the end of this, and so in conclusion, I'd like to encourage you to go over the content deeply. It's very important. Chemotherapy is a very important component of cancer treatment. Initially, it can be scary if you don't know what you're doing, but with practice and diligence, you'll be fine. Just pay attention to what we are providing in this course. And like I said, we're more than happy to make connections for you at Nigerian Christian Hospital so you can go to learn more. Also, understand the side effects and prepare to ask for your patient's interest. Thank you.